Hello and welcome, everyone. My name is Alina Rocha Menocal, and I am a Principal Research Fellow in Politics and Governance at ODI, and also Acting Program Director for the ODI-led Learning, Evidence, and Advocacy Partnership, or LEAP. I'm delighted to host the last webinar of the series we launched at the start of this month to showcase findings and lessons from the UK-funded Partnership to Engage, Reform, and Learn, or PEARL. I believe that we have approximately 250 people signed up for the session today. And I want to thank in particular PEARL and FCDO colleagues who are able to attend and be with us in this discussion. Let me start by saying a little bit about PEARL for those of you who may not be familiar with the program. PEARL was established in 2016 as an innovative governance program that builds on almost 2 decades of DFID and now FCDO investment in Nigeria and lessons learned. The program brings together governments and citizens groups at both the federal and the state level to work collectively to address governance challenges associated with the delivery of basic services. And it is also intended to be politically smart, adaptive, and anchored in learning. PEARL consists of 3 pillars working as one program. One of the pillars is called Accountable, Responsive, and Capable Government, or ARC, which is the supply side of governance, and it is led by DAI. A second pillar is called Engage Citizens, or ECP, which is led by Palladium and is the demand side of governance. And the third pillar is LEAP, which is led by ODI. LEAP, which comes to an end on the 31st of October, has led on learning across PEARL. This webinar series and related activities that we have organized are intended to share insights and lessons from the research that LEAP has undertaken over the past 2 years on PEARL and predecessor programs. The research that we have undertaken contributes to many pressing debates in the field, and we also hope that it will help to inform ongoing and future governance programming within FCDO and beyond. For those of you who were able to join us 2 weeks ago, you will remember that that was our first webinar where we were discussing how governance reform happens and how FCDO supported programs have contributed to such change. At that meeting or at that webinar, we also launched our flagship publication on the impact of 20 years of FCDO investment in Nigeria, which is available online. The second webinar, which was last week, focused on PEARL design and ways of working and highlighted lessons for how to embed thinking and working politically more effectively in programmatic practice. And this brings us to our third and last seminar today, which seeks to complete the puzzle by exploring whether and how governance can improve service delivery, looking at the work PEARL has undertaken at the state level in health and education in particular. I am very excited with the lineup that we have today to help us address this question. So let me briefly introduce all of the people that you will see on your screen so that you know who they are. And then I will explain to you a little bit about how we will proceed. We have Gareth Williams, who has led the research workstream within LEAP for several years, and also has been involved in a lot of the studies that we have carried out. And he also is the director or a director at the policy practice. We then also have Mohammed Sani Abdullahi, who until about 2 weeks ago, I think that's correct, was chief of staff to the governor of Kaduna state. And since then has been planning and budget commissioner of the state. And he also has considerable experience in development, policy formulation, public finance, and project implementation. Then we have Joe Wales, who is a dear former colleague of ours in the Politics and Governance program at ODI, and is now an education advisor in FCDO, in the FCDO education research team. And last but not least, we also have Miani Bukar, who is LEAP's national team leader and has been involved with LEAP from the very start in different roles. So let me explain to you a little bit about how we will proceed. I will start by asking both Gareth and Mohammed a few questions on the links between governance reforms and improvements in service delivery. And then I will bring Joe into the conversation to discuss how development programs like Pearl can support governance more effectively to contribute to developmental outcomes. I will invite Miani to come in towards the end to provide a wider set of closing reflections on why the work of a program like Pearl is important in the Nigerian context and what challenges lie ahead. Before I turn to Gareth, I also want to say that we very much welcome your comments and questions, and we will have time to go over some of those during our session today. The first opportunity will be after I have asked Gareth and Mohammed a few questions about the linkages between governance and service delivery, and then there will be a wider opportunity to interact with Joe as well. So please do use the Q&A box at the bottom of your screens to raise questions that you may have for the panel, and also to share any reflections that come to mind. We hope to keep track of those as well. And we will ourselves use the chat response, the chat box to respond to any comments that you may have or questions that you may raise, unless we can address them live in the panel. And also, if you feel comfortable doing so, it would be really helpful if you can tell us who you are and what your role is when you ask a question. Okay, without further ado, let me turn to Gareth as the first person that I will put in the hot seat, as it were. Gareth, you have been working on LEAP research for some time, very closely examining what the program has achieved in terms of both governance reform and improved health and education outcomes on the other. So I was wondering if you could share with us what improvements you have been able to detect from the research that you and other colleagues have done on both the governance side of things and the health and education side of things, looking in particular at the 4 states that LEAP research has focused on in Pearl. Thank you.
Thanks, Alina. I'm delighted to be here. Let me share a few slides, because most of the evidence on this comes from the flagship survey that was presented to this forum 2 weeks ago. Yeah, this is the report that was shared with you 2 weeks ago. We'll be putting in the chat all of the hyperlinks where you can download the documents that I'll be referring to. So for those of you that weren't at the session 2 weeks ago, just very briefly, this research looks at the impact of 20 years of governance programming in Nigeria. And it looks in particular at 4 states: Kaduna, Kano, Jigawa, and Yobe. And yeah, the collective influence of a series of governance programs funded by DFID, now the FCDO. And it looked at a huge range of indicators, both at the level of core governance, but also in terms of health and education outcomes. So it gives us a really interesting long-term data set where we can look at trends over time. And the general finding was, from the report, that both core governance systems and service delivery outcomes had improved markedly across the 4 states, but there were important differences between them. And I think by analysing those differences, we can start to understand a bit more about how core governance reforms impact on service delivery outcomes. So by core governance, we mean the processes at the centre of government concerned with budgeting, planning, policy making, human resource management, as well as changes in the arrangement of democratic oversight processes and accountability mechanisms provided by the State House of Assembly, civil society, and the media. And at this level, so this is just a summary of the main indicators that we collected through this report. But just to highlight a few of the key results, at this level, we found that particularly in terms of empowerment and accountability processes, there had been improvements in all 4 states. So these indicators measure the ability of citizens to participate in budget processes, the transparency of the budget, their ability to monitor the implementation of budgets, as well as how the State House of Assembly and citizens and the media hold government to account for their performance. In all the states, budgets became more transparent, and the State House of Assembly played a more effective role in scrutinizing budget proposals. We also looked at indicators of public financial management, and these have generally improved, but more variability between the states. In Jigawa and Kaduna, in particular, we noticed improvements in the quality of state-level policy planning and budgeting processes. I'm sure the Commissioner will be telling us more about this in a moment in Kaduna. Budget performance, which is the extent to which state governments actually execute the budget as planned, was very variable in states, between the states. Jigawa performed consistently well over 20 years. Yobe, mixed performance, but it improved since 2015. Kaduna also quite mixed, but we've seen really over the last couple of years a marked improvement in Kaduna as well. But in Kano, a worsening performance, and I think this indicates the often observed weakness in governance systems in Nigeria and how difficult it is to address this problem of budget performance. When we looked at the health and education sectors, we found that all 4 states had increased the share of the budget spent on health and education. And this was really quite a dramatic result, considering that over the time period we're looking at, resources available to the states from the federation account have been increasingly constrained. So in spite of declining revenues, states were still spending a bigger share of their budgets on health and education, a very important and dramatic result. Jigawa and Kaduna have achieved the highest share of actual spending in the health sector. In the education sector, Jigawa and Kano spent the highest share, although in Kano, spending per capita was much less than in the other states. So overall, we find that Jigawa performed best in terms of how it allocated additional resources to the health and education sectors. Kaduna has also done well, particularly in the last few years. When we looked at the actual outcomes in the health and education sectors, and here we were looking at indicators of maternal and newborn child health, immunization rates, gross enrollment in schools, primary school completion, gender parity index for school enrollment. We found that pretty much across the board, there were improvements over the 20 years, which was a most encouraging result. We didn't find all that much difference between the states in terms of these trends and the final outcome indicators. And I think the interesting point here is illustrated by Kano is that you can still get improvements in health and education outcomes, even in the context of weaker governance that I described. However, our hypothesis is that in this case, the improvements in health and education that we've seen have been driven more by direct service provision by donor programs who are providing these services directly rather than through government systems. And we'd suggest that the improvements in service delivery of the type we've observed in Kaduna and Jigawa that seem to be much more driven by core governance improvements will be longer lived and more sustainable. So that's just a quick summary of the results that we've seen in terms of core governance and service delivery outcomes across these 4 states. You can find out much more, look at the data in detail in the report for which the link is available.
Thank you so much, Gareth, for that very good picture, which is actually quite complex and diverse, right? So I'm wondering if you can tell us a little bit about the causal mechanisms that may be out there between actual improvements in different elements of governance and improved outcomes in health and education. Are there some trends that you see? Are there some relevant causal mechanisms?
Thanks, Alina. And this is the hard part and the million-dollar question that we're trying to address today. What actually is the causal link between core governance reforms and the service delivery outcomes? We've observed a strong association or a correlation, but the research was also trying to say something about what these causal pathways are. And we used to do this, we used a realist synthesis approach combined with process tracing to look at what actually happened, what sequence of events happened, and how we could trace that through from core governance reforms to sectoral outcomes. We also use this model of the service delivery chain, which is explained in the report, which basically just shows how improvements in core governance, starting with how national resources are allocated and prioritized and put into budget systems, how that then feeds through into sectoral governance, and finally to sectoral outcomes in terms of improved health and education. And what we were particularly interested in is the linkages in these chains. So how changes in public financial management actually feed through into more resources reaching the sectors and better services at the front line, or how mechanisms of empowerment and accountability ensure that those resources are better used in line with citizens' priorities. I think one of the really key findings, unsurprisingly, is that context really matters, and that the service delivery chain works in very different ways depending on the political economy context of the state. I think the standout finding was that in Jigawa and Kaduna since 2015, governors have enjoyed more political space to pursue developmental policies, including core governance reforms and service delivery improvements. The patronage pressures, it'll be interesting to hear the Commissioner's view on this, but patronage pressures, according to our analysis, seem to be weaker in these two contexts. Governors weren't so much constantly under pressure to meet the demands of particular interest groups in order to shore up their position and support. And this gave them more space, we argue in the report, to deliver on more developmental policies and better services. So in these more conducive contexts, we identified three main mechanisms by which governance reforms contributed to core governance, and by which core governance reforms have contributed to service delivery improvements. The first, and probably the most important mechanism, relates to systems for empowerment and accountability. Our research suggests that increased citizen participation in budgets through formal budget consultations or grassroots processes like community charters of demand have actually influenced budgetary priorities. We can track that through process tracing, and is likely to be part of the explanation for increased spending on health and education. And this has enabled citizens to voice their demand for service delivery improvements, and provided a mechanism by which state governments can respond to that demand. But crucially, citizen pressure is not just applied in the process of budget preparation, but also in monitoring the execution of the budget. There are more and more citizens groups like the Project Monitoring Partnership in Jigawa, and civil society networks like the Kaduna Basic Education Accountability Mechanism and CADMAM in the health sector as well, that have been monitoring the quality of service delivery and the implementation of publicly funded projects. So these mechanisms have provided new public spaces and processes for citizens to engage with government. The second mechanism relates to improved public financial management. So we observed a connection between more effective policy planning and budget processes, improved budget performance, and increased spending in the health and education sectors. And our research suggests that there is a causal mechanism connecting these changes. For one thing, more effective policy and planning processes like the State Development Plan and medium-term sector strategies enable states to prioritize health and education. More effective budget execution actually helps them to deliver resources in an efficient and predictable manner to those sectors. We found that in states, obviously, with weak budget execution, it's much harder to deliver planned resources to health and education in a predictable way, resulting in major efficiency costs. And then finally, the third mechanism, we did find some evidence that public service management reforms have contributed to improved service delivery. When we looked across the board at overall civil service reform, public service management reform, we didn't find general improvements in the states, but we did find specific examples of reforms concerning the recruitment and deployment of frontline workers, so primary healthcare workers, teachers, And this was strongly associated with improvements in service delivery. So, for example, in Kaduna, the reforms to the recruitment of teachers that I'm sure the Commissioner will talk about in a moment, ensuring that they were actually properly qualified does appear to be one of the major factors driving improved educational outcomes in Kaduna. So 3 main mechanisms. The first one around empowerment and accountability, citizens' voice and influence. The second around public financial management, delivering efficiency gains, cost savings, reduced wastage. And thirdly, the importance of getting human resources right to the front line of service delivery and the importance of governance systems in delivering that. So that's, in a nutshell, what we thought were the main causal mechanisms or contributions of governance reforms to those service delivery improvements.
Thank you so much, Gareth. That's very comprehensive and also very meaty. It helps to disaggregate different elements of governance that may matter. And I think actually on the citizen involvement one, citizen voice and accountability, it's actually telling that elections are not so much the conduit, but actual participation in processes of decision making. So that's really quite interesting. I wonder if I can turn now to Mohammed and ask you, Mohammed, from where you sit in the Kaduna state government, what kinds of linkages have you seen between core governance reforms in the way that Gareth is describing and service delivery improvements? And why has this been important in Kaduna itself? And how has the Kaduna state government sought to foster these kinds of reforms, both on the governance side and on the delivery side of things in a connected way? The floor is yours. Thank you.
Well, thank you very much, Alina, and thank you, Gareth, for that very good overview and presentation. I think that Kaduna is probably one of the major beneficiaries of 20 years of FCTO work because we came in, our current government came in 2015, and what we met was a huge database of work that had been carried out by successor programs from the Spark program and other programs, Savi, that had existed before the government came in. And one thing that was striking was that there was a lot actually to pick up and implement within those programs and those reports that hadn't yet been actually done, and which showed clearly how we could, from a governance standpoint, also move quickly towards implementing proper service delivery and getting the impact that our citizens wanted. A quick example, in 2014, a year before we were elected into government, the then government had spent $1 million on the entire health sector for 2014. But in that same year, when we went through the books, we saw that they'd spent over $6 million on hosting guests at the government mansion, basically. So there was clearly a mismatch between what service delivery was asking for and what sort of government expenditure was doing. And this was one of the core things that we wanted to reach out to adjust. And when we looked deeper, first of all, at the budget, we realized that for over a decade, the budget had the same core, the same skeleton, which year over year, politicians and civil servants would just simply take the items of the previous year, add a certain percentage across the board, literally draw down a percentage on the Excel sheet and then present it as a new budget, right? And so because of this, some items had remained within the state budget even beyond their importance or their value, right? And there was really no thinking that was going on regarding how exactly those items were not just a list of, to see them beyond a list of contracts that were to be awarded, but also to see how they impacted on the various sectors of the state. So one of the major things that we did starting in 2015 with support from DFID at the time, I believe it was Parallel Arc, the ending of Spark, was to initiate what was a zero-based budget. Basically, we started from a fresh template and asked everyone to justify why things needed to be on the budget. which was a revolutionary process because over the last, as I mentioned, 2 decades, they've just simply been used to taking the Excel sheet from the last budget and then just adding a percentage and then moving it. So getting people to justify why things had to be on the budget was significantly revolutionary and disruptive to the entire process. And so by doing that, we were able to take out significant amounts of government, quote unquote, expenditure and then move them to the service delivery end. And so from spending for $1 million a year on health sector, while you're spending $6 million in government house feeding alone and gift items, we were able to achieve 26% of the budget on education, right? 15% of the budget on healthcare. And you can see that clearly in the 2016 budget. And that's why you see the trend in Gareth's graph going upwards right from 2016. It was because of this very, very huge and monumental shift that the proper budgeting had allowed us to make. Another major but rather small addition was when we joined, the ministry was called the Ministry of Economic Planning, right? And there was a huge debate in cabinet regarding what the function of the ministry actually was and why many state governments still opt for calling it the Ministry of Budget and Planning. We changed the nomenclature to need to come before the budget, right? Now it's a small change, but it's actually fundamental in the way that people think. Because if you take it as a Ministry of Budget and Planning, the way you talk about is bringing all the expenditure without having a plan. And what we knew that we needed to do was to put together a proper policy making framework to ensure that what we were actually spending resources on was what we plan to achieve in healthcare, in education, in infrastructure, and water resources. And so the shift was made to call it a Planning and Budget Commission. And so with that came a plethora of plans, starting with our State Development Plan in 2016, which really laid out as a core where we were and where we wanted to go to in terms of both the economic and social sectors, right? And we were very clear that the budget wasn't merely a financial distribution of what money goes to which department within it, but what it represents the core of our economic framework. It represents the level of taxation that we're aiming at, the level of debt we're aiming at. But much more importantly, it represents how we want to allocate resources to key social services like healthcare and education, and how we want to eliminate issues around inequality, how we want to fight HIV/AIDS. All these guiding principles lead us to that. And so when we worked, for example, with DFID to craft our first medium-term expenditure framework, it was very clear when we did the analysis of budgets in the years past that these core issues of governance were more or less thought to have zero or no link to service delivery issues. And what we tried to do with the MTEF was really to bring these abstract economic concepts, abstract governance concepts, right to the doorstep of how do you actually improve the lot of the people that are living in our rural areas. How can we ensure that we use the budget to ensure that our women are no longer dying from childbirth, for example? How do we increase net enrollment rates? And with that, those core changes came a significant number of policy reforms that really hit at the core of what the state was facing as a challenge. We were sure that if we were able really to affect and influence the core of these processes, that then we would be able to see the outcomes. And so we started from the policy planning, right? And then moved on very quickly to sector implementation plans, where the healthcare sector, the education had very, very detailed targets, with the results that we were able to then link these outcomes, these targets, to then say, okay, how much money do we actually need to be able to influence the number of women that die in childbirth? How much money do we need actually to influence the number of people that visit the hospital because of malaria, right? How are we able to really use these resources, not just as a list of contracts of this road or that road or this hospital or that hospital, but as an instrument of change? And I believe that that's been at the core of the business of governance that we've been doing over the last 6 or 7 years. But at a point, we were able to quickly realize that if we were not able to monitor how these resources move from public coffers all the way down to the last mile, right, that we would be leaking a lot of resources in the process. And so we started a monitoring evaluation program called the Eyes and Ears. We were able to talk about this even at international forum like the World Bank spring meetings in 2018, where we really started it off as a government program with 9 officials going out to ensure that they could track government resources. But after 6 months of implementing it, we were very certain that 9 people could not track the amount of resources that we were sending out to affect the lives of millions of people. And after significant debate, what we came out with was the best people that could help us to monitor the amount of resources that we're spending were the citizens of Kaduna themselves. And so we empowered the citizens of Kaduna with a monitoring app, which you could download on your phone, and head out and help government to actually monitor. And whatever you do ends up on a dashboard with the governor. Now, what that really did was to cement the social contract between our people on the ground and us at the top to ensure that what we're actually working for, they can track the resources. And that led us to joining the Open Government Partnership, for example, as one of the first subnational governments in the world to ever to do that. And Kaduna was accepted at the level of national governance because one of the things that we were implementing was really, really critical. Now, what we've learned over the last 6, 7 years is that you cannot divorce or remove the importance of governance in the way that you influence service delivery. You can try, and I've gone through the paper and I've seen that there are various methods. Either you start off from the bottom up or the top down, and I feel like what we've tried to do is a mix of both, right? But one of the major issues that we've also come across is the importance of the parliament in terms of cementing that political commitment. Because as much as the budget is thought to be a technical document, it is the biggest political document that we have, because where you're spending your resources is a political statement of what you want to do. And politicians feel very strongly around how you structure your resourcing. And so we've really found that the partnership with the parliament, the legislature, in terms of the budget process, right from the beginning, getting them to understand why we are pegging the budget at a level that is more credible than we would through the MTF and all of that is critical.
And Mohammed, thank you so much for your remarks and for delving into it so deeply. I wanted to ask a couple of follow-up questions, but I will just park them for both Gareth and yourself to think about. For Gareth, I had a question about how citizens are organized so that their voices can actually be heard. Is it mostly through these invited spaces of interaction with the state, or are there other ways for them to organize and exercise influence, and where does power lie here in terms of whose voices are heard? And for Mohammed, I think you were getting into it actually in your remarks, but it would be really nice to hear a little bit your reflections on how a program like Pearl has helped to shift or improve, let's say, the quality of the interactions between state and society so that they can actually work collectively, because this was one of the main objectives of the program. So let me just park there for now so that we can continue to move swiftly. And now I want to move from theory to practice, let's say, or really focusing on development programs and what is needed to be done there to ensure that development programs focus both on governance reforms and then on improvements in health and education in ways that are mutually reinforcing. So Gareth, that's a question for you. From the work that you have been doing with Pearl and beyond, what is needed to ensure this sort of greater synergy building between governance reforms or support to governance reforms and improvements in health and education? And just briefly to say that the paper that you wrote with Helen Derbyshire on this very question of synergies between sector and governance programs should now be online as well. So maybe Paula can share the link. Thank you.
Yeah, thanks very much, Alina. So yes, this is the paper that you mentioned that we've also been working on in parallel to the flagship report, looking at how effective collaboration has been between governance and sector programs and assessment of the evidence on what works. I think the main point I'd like to make in response to your question is that both from a theoretical and a practical perspective, I think it's only possible to deliver improvements in health and education by working across the whole of the service delivery chain. Working just on the core governance systems upstream is not enough if you're not actually engaged in schools and health centres. But working in the schools and the health centres isn't enough if you can't address some of the core governance problems that we've also been discussing. We need to do both, and we need to think about connections in the chain and supporting the causal mechanisms that bring about change, whether this be through improved public financial management, empowerment and accountability, or human resource management. There are lots of ways that donors, governments, and other development actors can work together to make these connections. And we looked at this in this research study. When we looked at the connection between governance and sector programs, what we found is that in principle, governance and sector programs perform mutually supportive and complementary roles at different points in the governance service delivery chain. But we found it's actually quite difficult to do this collaboration in practice. We did find some really positive examples of collaboration. For example, another case study that I just put up here on the education reforms in Kaduna looked at the collaboration between the FCDO Pearl program working on core governance and the teacher development program working on teacher training and skills. The two programs were able to work together very effectively to support the state's reform efforts in teacher recruitment and deployment policy. But there were also lots of examples of programs working at cross purposes and undermining each other because they had different policy and funding approaches. So while governance programs have been strongly focused on making resources available to health and education through the state budget, sector programs have often resorted to direct funding of health infrastructure and services. Less so now, I would say, but there has been an issue in the past of these programs have bypassed the governance systems that the core governance programs were set up to strengthen. So we found that overall the collaboration between sector and governance programs was quite patchy. It had occurred in all states over time, but the pattern was variable and patchy. Collaboration being limited to particular cases rather than the result of a systematic approach to tie these programs together. So plenty of room for improvement, and I think research like this has helped to give us some lessons about what works and what doesn't work in terms of getting collaboration between programs, which hopefully can be used in the next round of health and education and governance programs that are being established in northern Nigeria. One of the key lessons is that coordination between governance and sector programs works best where the state takes the lead in aligning programs in support of a single strategy. And I expect the Commissioner will want to talk about this in the case of the Kaduna example in a moment. Just perhaps a final idea to leave you with. You can work at this really in two directions. You can focus on core governance programming, tackling the bottlenecks in public financial management, empowerment and accountability, and hope that that feeds down into service delivery improvements. That's tended to be the traditional approach. But there is another way of looking at it, which is to actually start with a concrete and focused service delivery problem and using this as an entry point to reveal some of the weaknesses in core governance that may be contributing to that problem and then moving up the chain to core governance. This is what FCDO calls the issue-based approach. And in our report, we have some examples of where this has worked well in practice. So one of them was in Jigawa, where I think it was the SLGP program identified the problem of erratic water supply in hospitals as a key service delivery problem. This then led them to identify procurement systems in the health sector as being a critical bottleneck that was causing the problems in water supply, and eventually to questions around overall budget allocations to the health sector. So that's just one example of how you can work back up the service delivery chain. In my mind, you can do it both ways, and we probably should be doing both at the same time. But the really important point I'd like to emphasize is seeing this governance and service delivery chain in an integrated way and working across the chain to link up these various approaches.
Thank you, Gareth. You mentioned a few things that are of interest both to Mohammed and to Joe, whom I want to bring in swiftly as well. But briefly to Mohammed, one of the questions that has been raised here is around how a state like Kaduna can work with the different development partners that are on board in a way that coordinates their support and ensures that it's aligned with the priorities that you may have at the state level in terms of governance and service delivery. Can you tell us a little bit about how you have sought to get that coordination and alignment going? And if you can keep your remarks to about 3 minutes, that would be fantastic. Thank you.
Well, thanks a lot, Alina. I think that certainly that has been an issue in the past, where we had several donors with different funding sources and different objectives working in the same sector. The health sector, for example, is a darling of donor partners. So we have a plethora of partners working right from the top all the way to the mid level, where they're focusing on various initiatives, with many having different objectives as to how to solve the same problem, right? And so what happens is that you are facing the health sector, for example, where half of the staff are out most of the week attending one donor training or the other, or one donor conference or the other, and nobody's around to actually deliver guidance to the health sector, right? Or where you have donors funding multiple initiatives, which the state is also funding, and so leaves room for corruption, right? And so these are issues that we face for at least the first year and a half of our government, until we had a sit down, first of all, informally with some of the major partners of the various sectors, and then decided to coordinate more closely with them. Ultimately, this ended up after, I think, 2 years with an agreement, written agreement from all the major funders, which we call the DCF, the Development Cooperation Framework, where everyone actually signed up to support the state in its focus and its priorities. Because we had to then put our foot down to say, look, we called everybody together, put together the state development plan together, which had all the sector priorities as well. So make your inputs to the state plan. We will take it, review it, and then agree on the way forward. And once we're able to develop the state development plan, then we were able to then shop it to our partners and say, look, this is our focus, right? And this is what we want support on. And we got large agreement from DFID, from USAID, from the World Bank, from the IMF, from all of the partners that we work with, and they signed up to our development cooperation framework. Now that has set out sort of the reporting lines and the coordination lines where we no longer have this confusing state of everybody trying to do everything at the same time. The first DCF expired in 2019, and we've just now signed a mutual accountability framework with FCDO, which we are hoping would also do the same thing, and we're trying to get the other partners to sign on to. That has been really, really important in terms of saving resources, not only for us, but I think for the development partners as well, as ensuring that we're actually pursuing development on the same track.
Fantastic, Mohammed. That's extremely helpful and very wise, actually. So thank you so much for sharing that. May I now turn to Joe? Joe, I think Gareth shared some really important insights about how governance and sector programs can work together, and also how they can, in fact, work not necessarily at opposite ends of one another, but not necessarily reinforce the synergies that are needed. Having listened to the previous presentations and the discussions, what are the top 3 things from the research on the connections between governance reform and service delivery improvements that you think are most useful for FCDO to think about in terms of future programming? Thank you.
Grant, thanks very much, Alina, and thanks for bringing me into this. I think I'm probably going to talk at a relatively high level here. I've had like a little role at the beginning of this project, but haven't been that well connected since then. So I think one of the really positive things which comes out of this report, it demonstrates the potential that there is from linking governance and sectoral programs. And the examples which are there, particularly around using kind of this issue-based approach, kind of using specific entry points in terms of service delivery to address some of these issues and to bring together some of our, some of the colleagues who are working on governance and who are working on education issues. Demonstrates some really positive examples there of how that can be done. I think as an organization, one of the things we do face challenges with is precisely tying up some of these questions and expertise around governance and around sectors, and ensuring kind of that we take a broader view that it's not a case of funding specific service delivery, but it is about how do we work with our counterparts in national and local governments to resolve issues rather than creating parallel systems. But there's often a challenge there. The incentives that our advisors have, the different ways that they're funding, many of the things that Gareth has already pointed out, really create difficulties in how we draw those together. So there's definite value from this research in terms of illustrating kind of how we can begin to bridge some of those gaps. But I also think a really important thing to focus on here as well, has been the role of state governments in, bringing donors together and having a coordinated plan. And one of the things I think we need to think about from FCDO's side is how exactly we can, positively engage with those processes and not be just bringing in kind of our priorities from outside and kind of fostering that instead. A second point really is around, some of the limitations and how we sort of set expectations for ourselves around this. There's a lot of positive examples and indicators that Gareth has put forward. Very strong progress in some areas, less so in others. And thinking about basically what is viable and for this work to do is very important. And thinking about as well about kind of differences across these different contexts as well. This type of programming will, help to address issues in some areas where there are kind of political incentives which are aligned for that to happen, where you have those particular moments where this can occur. But equally, there are some areas which are potentially too sensitive politically for rapid changes. You need to just be, well aware of what can shift and when. And this then draws on kind of onto my third point here, which is really the importance of taking kind of the long view. I mean, it's quite striking that we're talking about 20 years of engagement by DFID here, that you have examples of programs which are very well embedded in the context that they're working in, that are connected to state governments and, understand very well the challenges that exist around kind of around accountability of the different demands that the politicians and civil servants and the general public as well face in those contexts. And that it's been in place for kind of extended period of time, and it's been the opportunity then that as particular political moments have occurred, that you then have people who are in place who can work with governments and with administrations which have an interest in reform. And it's one of the striking things that Mohammed said as well when he was speaking, is that when they arrived in government, there were these programs already in place, a lot of background work which had been done, and things that could be picked up and used. I think one of the challenges that we face, as an organisation, is that's not the case in a lot of places where we work, or at least not to kind of the same level. And here, I think, to be kind of maybe very sort of FCDO internal, I mean, the merger between DFID and the Foreign Office does kind of create both opportunities and challenges here. There's a tendency, I think, in the past for DFID to be very, very programmatic, very kind of stop-start, and merging with the Foreign Office does create the potential for taking a longer and more kind of political view of development and how exactly we support reform efforts in different contexts. Equally alongside that, though, there's obviously a range of challenges currently around budgets, the uncertainty that creates, and the barriers that puts in the way of this type of long-term and consistent engagement and programming. So I think that's again something for us to take away and think about as an organisation, and how we adapt to our changing circumstances as well. But no, thanks very much for drawing me.
Thank you so much, Joe, also for joining us, because I think you have a unique profile in terms of having both a very solid and strong governance background and now also working at the sector level of things. So your perspective is very welcome. We are now going to have some time finally to get to the questions and comments that we have gotten from the audience. And for those of you who have other questions, please feel free to type away. I had parked a couple of questions for Gareth and for Mohammed, and I will let them ponder on those while I share some of the questions and comments that are coming from our chat. So we have someone from APT who is saying, on the increased budget allocation for health and education, it appears that there are multiple possible causal routes for the favorable shift in intersectoral allocation. And he cites some of the many mechanisms that were talked about here: citizens' voice and accountability, sector budget justification and lobbying, state assembly scrutiny, PFM budget process reforms, and also pressure from DFID with an exclamation point, which I think is a really important thing to keep in mind as well, either formally or informally. And so he is wondering, the person asking this question is wondering, which of these 5 mechanisms do you consider to be the most influential in changing sector allocations and to be more sustainable? So which one is most influential and which might be most sustainable, and why? Another question that we got, which actually relates to some of the discussion we had in the first webinar that we held, is around the role of the legislature in the oversight of the budget implementation. Is the legislature also empowered to perform one of their key constitutional functions in this realm? And if so, why? And I think this is a point that Mohammed raised in his remarks, but also I remember Laurelin saying that in terms of governance improvements supported by FCDO's investment in Nigeria, reforms got the least traction at the parliamentary level. So it might be interesting to hear a little bit about that. There's another question here around the fact that we're talking in Nigeria of a context that is democratic, however challenging. And the question is whether approaches would need to be different in terms of promoting service delivery if one is engaging in contexts that are more authoritarian or more fragile or more kleptocratic. So do we need to keep regime type and intention, I suppose, into account? And then somebody is asking a question that I want to keep to the end, so I won't reveal it here because I want to keep the suspense. Then we have Kathy Bain, who has been herself involved in the LEAP program, who's asking Gareth, given what the commissioner has presented regarding the importance of planning around objectives and then aligning resources to meet them, why do we not see any improvement in PSM mechanisms? The graph suggests only efficiency gains in PFM, but no real changes in planning and policy making. So she's asking if this is inconsistent with what the commissioner has shared. And Kathy also has a question for both Gareth and Mohammed. The report suggests that context is critical. Jigawa seems to have outperformed Kaduna across the board. This might be surprising to some given Kaduna's recent leadership and disruptive reforms approach. What contextual factors in Jigawa have enabled this superior performance? I think that's a lot for all of you. So I will, and also I think that's the end of the questions except the one that I'm leaving for the end. So let me perhaps try this in a different order than how we started. So Joe, may I ask you to respond any questions that tickle your fancy, and then I can move on to Mohammed and then finish with Gareth.
Thanks, Lynn. I think probably the only one I'm really in a position to answer is maybe to talk a little bit about regime type. Maybe the kind of the ways our approach vary across those. I think in terms of kind of thinking about addressing governance alongside sectoral issues, that's something which would kind of apply across a whole range of different environments, but you would just you would use very different approaches, I think. Obviously in spaces which are ungoverned and where there's kind of more limited political authority. there's also just a question of kind of who is doing the provision in practice as well. And there's many environments where, you know, we would want to be engaging with kind of with non-state providers. But I think in many ways, kind of the core of what we want to do here remains across those as well, as the challenge of how exactly you do coordinate quite a disparate range of actors, but how you are building up national systems alongside that as well. I think that's probably a much more complicated question than I'm in a position to answer here. So we definitely would need to vary. I mean, and also alongside that as well, there's a question of kind of, particularly in terms of authoritarian regimes, who we are able to and kind of comfortable with engaging with in those contexts. Yeah, obviously kind of puts limitations there. But I think it is interesting kind of what's the potential that's set out here and kind of, you know, elsewhere in the literature as well around creating spaces for positive engagement between citizens and regimes, particularly around service delivery, and whether or not that begins to create space for kind of active engagement and for kind of a different type of citizens friendly and relationship between kind of state and population. Yeah, there's a lot to think about on that one as well.
Excellent, Joe. Thank you so much. There's another question for you from Kathy coming in briefly around donors struggling to incentivize coordinated sector and governance programs. Local coordination by governments is obviously one way around this, but in the present context in FCDO, with a lot of the cuts in aid and the need to do more with less, is there hope that FCDO can more actively encourage collaboration upstream and systematically? So if you can respond to that in a minute, I can then shift gears. Thank you.
So I definitely think that, well, I hope that with our own resources being more limited kind of in the immediate future, there's kind of an even stronger need for collaboration across different donors and making sure that we're coordinating properly there. I think there's obviously a challenge then in how much support we can provide in specific contexts, but I think it really reinforces precisely that need to be engaging and to be thinking particularly about, you know, how can we use the resources we have to support reform efforts, rather than necessarily thinking about kind of direct funding of services or the establishment of separate areas of service delivery. Yeah, I think that's probably the main answer.
Thank you so much, Joe. Mohammed, let me turn to you. And I know that I read several different questions in one go, but let me just perhaps zero in on the ones where I think it would be really great to hear from you. One was the question that Kathy Bain posed around the conundrum between Jigawa and Kaduna in terms of reforms, especially given the disruptive leadership for reform in Kaduna. And the other is the question that was posed by the APT colleague on the different mechanisms that there might be to try to influence budget allocations for health and education, and which of those might be more or less sustainable and more or less influential based on your experience, obviously, where you sit in the state government. Thank you. Oh, I think we lost Mohammed. So sorry. So maybe Gareth, Gareth, maybe I can turn to you. There were also many questions. This one was one of them around which mechanisms may matter more or less. And I think you probably also can address the question of how approaches need to change when you have a radically different context that is less open, let's say, or less democratic. And also there was that question that Kathy raised around some contradictions or inconsistencies between what you were saying and what the commissioner was sharing. And I do hope that we can get the commissioner back online. I think the team is working on it. Oh, he's there. Gareth, I want to turn to you, and then I'll pose the questions to Mohammed. Thank you.
Thanks, thanks, Alina, and thanks to everyone for the really interesting and challenging questions. I'll try and respond to at least some of them. I mean, first of all, on Paul Smithson's 5 possible causal routes for the shift in resources towards health and education. I think all of those have been relevant, but the mix has varied between states, and there are actually perhaps some other ones. I think a key feature in Nigeria is often the vision, commitment, and drive of the governor, himself. Yeah, I say himself because all governors are men at the moment. So in Kaduna, when El Rufai was campaigning for election in 2015, education was actually high on the manifesto as an issue that really needed addressing. So I think, yeah, we've seen a similar situation in Yobe where there was a state of emergency declared in the health sector previously. So I think the kind of messaging coming out from governors and how voters respond to that is also another important mechanism. Alina, in your question about how does civil society actually engage to influence budgets, yeah, I think we can unpack that, because there are several different mechanisms that we've seen. At the grassroots level, mechanisms like community charters of demand generate kind of demands for very local projects, often connected with service delivery. But we've also seen the growth of the media increasingly critical and focused on service delivery and policy issues through phone-in programs, putting commissioners on the spot. That's been a major trend. And then perhaps more organized civil society engaging at the state level in budget processes in a more formal way. I think over this 20 years, one of the biggest changes has really been around the increasing organization and vitality of civil society and how it engages in policy processes. So I think definitely that mechanism has been critical in shifting resources towards service delivery sectors. State House of Assembly scrutiny. Well, we did find that the State House of Assembly was very active in the stage of budget preparation. So making its views known on how to allocate resources, less effective in terms of monitoring how resources were actually spent. But in terms of sending signals, I think that's also been positive in pushing budgets in this direction. Yeah, pressure from FCDO as well, but I would say that in a country like Nigeria, no donor is particularly influential. Most of this is coming from domestic political processes, but I think, yeah, the whole international environment and yeah, the push for increased resources for health and education, even through the Abuja Declaration itself, have been important drivers as well. So yeah, multiple mechanisms. They've worked in different ways. Yeah, really important, interesting question about this applies to a democratic context. What would this look like in an authoritarian context? Should donors just go straight to service delivery and not worry about governance? Well, we only did this research in Nigeria, but from some other experiences I've had, I would suggest that even in some authoritarian settings, there are still useful things you can do around governance in the service delivery sectors.
Gareth, sorry, I may have to stop you right there, because we want to have some time to enable Mohammed to join the conversation, and I don't want to wait too long. Miani, I'm sorry to interrupt you, because I know that this is a huge topic, but let me ask Mohammed, who has just been able to rejoin us. From the questions we have received in the chat, there was that question about the challenge between Kaduna or the disjuncture between Kaduna and Jigawa in terms of progress related to reform, given the leadership, the kind of leadership that you have in Kaduna, and what may account for the fact that Jigawa seems to have done best overall in terms of reform. This question that Gareth has also addressed around which mechanisms might be most influential, but also most sustainable in terms of ensuring greater budget allocations for health and education. And from the perspective of an authority figure in a state like Kaduna, how would you think of these in terms of which are more important? Somebody was also asking about the disjuncture between having policy on paper and then the implementation. And I'll leave it at that because there's a lot. So Commissioner, the floor is yours, and you have a few minutes before we bring our friend Miani to the floor. Thank you.
Thank you very much, Alina. I apologize, I lost connection, so I might have missed a couple of the points that had been raised. But just very quickly on the Jigawa versus Kaduna, I think that was very interesting on the research, and we'd love to delve deeper into it. But I would say that even in 2015, when we came into government, Jigawa was already a model for implementing governance reforms, right? Kaduna and Jigawa had the same programs, Savi, Spark, and all of that. But the difference was that Jigawa had actually picked those documents up and been implementing them for a decade before Kaduna came on board, right? So we came on board in 2015 and picked up all the documents and started implementing then. So I believe that time lag might have accounted for this quality that you're seeing, the differences in the PSM. And it's just because the government at the time didn't take it up. And so we met a lot of rich information that just hadn't been implemented. So I believe that time lag, but I'd love to engage with Gareth and the team to see if there are any things that also might be the reason for this. On the PFM versus PSM question, I believe that usually when you start with the reforms around PFM, it takes a bit there's a time lag for service delivery impacts actually, for you to be able to actually see, for example, the changes in maternal mortality or childhood infant mortality and all of those things. So I believe that may account for it, but I think in the various options that have been given as to what is the main reason that may account for example, sectoral allocations, I believe that the justifications from the sectors are probably more sustainable. And actually the most sustainable thing for us has been having a coherent plan that lays out a 3-year budget framework, for example, in how you're going to actually be allocating resources. I would put much, much less emphasis on FCDO or pressure or anything like that. As Gareth has said, I don't think Nigeria as a country really responds to a lot of that. I think if we're able to put out a coherent frame and the reason why over the next 3-4 years we need to put the money in these places, I think that would be much more of a much reason to get those things. Very quickly on the House of Assembly oversight, because I glimpsed at that before I left, is that the House of Assembly still does have that constitutional responsibility of oversight, and nobody is touching that. Even if citizens join, I feel like it's just more eyes on the same pie, and it just allows us to be able to track resources more. There have been a number of other questions in the comments in the Q&A, particularly regarding the citizen development, the charter that we signed with citizens in terms of the state budgeting. I believe that has brought a lot of oversight and a lot of good practice in terms of how we actually including citizens in monitoring from right from the budgets all the way to the service delivery and sort of completing that chain. Thank you very much.
Thank you so much, Mohammed. And without further ado, I wanted to bring Miani in, who, as I said before, has been the national team leader for LEAP and has been involved in LEAP in a variety of different roles across time and space. So he has a very good platform to sort of take a wider perspective or a broader view, perhaps. And Miani, I was wondering if you can tell us a little bit about what you see as the most important challenges that Nigeria confronts today in relation to governance and service delivery, and how the work that FCDO has supported in Nigeria has been important or meaningful in this respect. What has been achieved and what remains to be done, especially in the context of the 1-year anniversary of the NSARS protests today and in the run-up to the elections coming up, and what kind of role is there for international development actors like FCDO in fostering needed change going forward? And of course, since you are a wise man, you will be able to address all of these questions and solve the world's problems in 8 to 10 minutes, Miani. Thank you so much.
Oh, I hope you can all hear me. It's always interesting when you start your comments based on a lie because someone said you're wise. From then on, it is wild out there. So I'll do my best, not because I'm wise, but because we're all learning. In terms of contextualizing everything that we've spoken about in the past hour plus within the context of where Nigeria is presently. And you mentioned the NSAS demonstration that it's like 1 year tomorrow and all of that. I think to take a broad look at it and try to really simplify it, from where I sit in both working in the past within government and now, what's clear is that if there's one area within the Nigerian system that really has highlighted itself as very critical, is the space of accountability between citizens and state. And to what extent the citizens are able to express their voices. Why I think that is the most critical, it's because that is the platform for any kind of conversation that would start from what the citizens consider their needs, translate that into a demand, which then rightly within a system of sound accountability would further on translate into government's priorities. So moving from citizens want A, B, C, D, E to someone in politics is campaigning and promising that, to they now move from political promises to implementation of priorities that are now policy. And I mentioned that for two reasons. One, as we've heard during the time that we've been speaking and from Gareth's presentation and Mohammed's and interjections, what's unique about what we're talking about here is that governance reform has not only fed at the entry point into what happens on service delivery priorities, but has led to service delivery. And to the extent that in any country, and even more so a developing country like Nigeria, any kind of conversation around governance, any way you would hold a government accountable that does not immediately tie to service delivery on the ground tends to lose traction with citizens after a while. So it's an unsophisticated space, which provides a lot of opportunity to ensure that by keeping your eye on the priority sectors like education and health, the way Kaduna has done, there's a direct correlation from what the citizens say they need, how government has been held accountable, and what the research has shown has indeed, from a governance reform point of view, fed into, contributed to, and in some cases just outrightly led to specific improvement in service delivery. So in terms of where we're in Nigeria now, I would say that is a critical thing to note. As we get closer and closer to elections, I think that challenge is not going to go less. It's going to be more pronounced, which is great, because Nigeria's social contract has always remained kind of weak because the Nigerian state doesn't generate most of its income or run its machinery based on tax from citizens, rather from returns from the sale of oil. And so the space for tax being a tool of accountability has remained weak for a very long time in Nigeria, but we always get this opportunity around election periods where there's a groundswell of very clear demands, which then sets the tone. In terms of also just learning generally, but also looking at challenges, and because of the time, I kind of will move between two challenges within the Nigerian system, but also within the Pearl program itself, and what maybe the whole donor community can take from that. The first is just there is challenge with capacity to deliver and deliver well within government. And it took Pearl quite a while to get to like the real nerve points as to how to address that in specific places. But because by design thinking, Pearl had been set up with 3 pillars, and one was focused on building government's capacity to deliver in a manner that is very, very deliberate and upfront. In all of the locations that Pearl has been, what you will see is a correlation between the kind of capacity we've seen displayed by partners in government and success in delivery, and maybe even if we have the data and time, measurable impact, which has not been done so much right now. So that's something that will remain a challenge for a while, but it's good that we are learning from Pearl what to do about it. A great challenge, which is both a challenge and an opportunity, is a program that doesn't stand alone, but brings 3 pillars within it that look at various aspects of governance reform, so that those working within the pillar that is ARC, and those working within the pillar that is ECP and LEAP responsible for learning, are not operating in silos, fed into each other in a manner that made it much clearer to see that the areas and the sectors, like in this case, education and health, that the Pearl program was focusing on and providing support to partners like Kaduna State to deliver well, was very easy to do because it was not at any point perceived as the donor's agenda. There was a whole issue identification process that involved the voice of citizen. So what we've seen in that, and Mohammed spoke even a little more, a little deeper about it earlier, is a departure from what has been pretty much a bit more of the tradition where government would sit in a room, establish its priorities, run its distance, and then at some point have this one big workshop that is aired on TV and bring civil society people that are their friends and say, we have had civil society engagement, now we're going on. But the fact that there was an issue identification that brought citizens' voices from the get-go, and then throughout the process, because of the correlation between ARC and ECP and us working in silos, what we've seen is a lot more clarity around providing support by donor programs that is not only from the government and the folks sitting in government house, but clearly also the felt needs and demands of the citizens, because that was taken into cognizance from the beginning, not halfway or not at the very end. I think that maybe the last comment generally around that, looking a bit more about what to expect, for FCDO, for other organizations. 2 things I think provide us a great opportunity right now. One is because Pearl has been or is a learning program with the necessary design components for adaptation, and it's gone through very painful 5-6 years in learning itself how to learn. And it's where it is now. There is a lot to learn from that moving forward. There was a question, I believe, from Kathy, where she highlighted if there's any learning around the fact that FCDO is saying, let's get more bang for our buck, and we're tightening the belt. And I think that a program like Pearl actually provides quite that opportunity where you can see the correlation between the various aspects of what government is doing. And so in making sure that you're working in lockstep and each is feeding off the other or each is reinforcing the other, we'll be able to generally work in a direction that would get donors more for their money in terms of impact. The fact that issues are identified with citizens means also that when they go to town eventually and get feedback from citizens, because partners like governments and what have you, most likely always tell you you're doing a fantastic job because you're giving them some money and some technical support. But that there is more feedback from citizens as beneficiaries as well, should provide an opportunity for FCDO with a tighter budget. So for me, the learning from this is, it's been a tough learning process for an adaptive program that Pearl has been. But for FCDO and other donor programs moving more into the direction to get close to elections, this is an opportunity not to abandon it because it's had very painful phasing process, but that this synergy would actually provide what is beginning to look more and more, I wouldn't say formula, but at least a principled approach that can be explored deeper. And the last one is we're leading up to an elections very soon. And for once FCDO and other donor programs have a good opportunity to have programs that would work closer in terms of the rhythm of the politics and the setting up of priorities. And so whilst we're looking at all that has been learned in specific locations in sectors, there's an election coming up, and these same sectors, health, education, I dare say, if you add agriculture, security, and maybe infrastructure, would be the main things that will be talked about. And so there's this whole body of learning from the locations that Pearl has worked in that can benefit Pearl, FCDO and other donor agencies as they seek to engage with the country after 2023's election and enable them to move forward in that same direction to reinforce. So those like my just broad thinking. Like I said, I laid out the caveat. Alina lied when she called people white. And I hope it's helpful, and any clarification we can provide, even if it's not here, just reach out and we'll either point you to the document or just have further conversations. Thanks a lot, Alina.
Thank you so much, Vianney. That was very also very coherent and thought through, especially because I know that I asked you very difficult questions. So thank you very much for your insights, especially in the run-up to the elections and what you have said about the role of health and education there and the lessons and opportunities within FCDO. I want to go back to one question that Joanna Russon from the University of Nottingham has posed on the chat, which we also wanted to go back to, and which actually is something that a lot of you have already touched upon, but I wanted to ask if there is one thing that we could ask FCDO or another international development actor to do differently to improve governance for service delivery in education or in health, what would that be? And let me start with Mohammed. All of you have 1 minute, so it has to be a very quick sort of tool that, but Mohammed, 1 minute. What is your one ask from FCDO to do differently? Thank you.
Well, thank you, Alina. I mean, I feel like the work that's been done by FCDO in the past is monumental, and it's fantastic, especially when you have willing governments like ours that are ready to pick it up. What I'm a bit sad about is that over the last year or 2 years, I believe, we've seen significant decline in activities from the partners that FCDO supports. And I believe that this might be policy issues from the top, but I feel like we are almost at the crux of what all the investments of the last 2 decades have really sought to do. I feel like we're at a level where the absorptive capacity of our country, Nigeria and the States, is getting to a level where everybody's understanding and everybody's trending towards these issues. So my appeal is that this is not the time to pull back. We're hoping that we will get much more partnership and stronger investment from FCDO, and not to leave it just when it's at the cusp of really something huge. That's the answer.
That is a great note to end on, Mohammed. Thank you very much for that. Joe, I know you pointed out a few things based on where you sit within FCDO. So if there's one thing that you could sort of think about doing differently starting on Monday morning, as Simon Maxwell used to say, what would it be?
So I thought I was going to take the next couple of minutes taking notes from people, and others have wisdom for me on this. I think, what can we do differently on Monday morning? I think, yeah, the challenge for us is basically taking, particularly on service issues, this broad view. Yeah, thinking about kind of the governance aspects of it, really approaching us as a system, but doing that through this kind of lens of specific issues, kind of where can we support reform efforts that are ongoing. Sorry, it's not a very good answer there, but yeah.
Sorry, Joe, I know it's a bit harder for you because of the hat that you wear, but thank you very much for your comments. Gareth, maybe can I ask you for 1 minute?
Yeah, I mean, I can only really speak about education in Nigeria and how I've seen it, but I think my main point would be for FCDO to really get to grips with the governance of the education sector. We understand a bit, but I was quite surprised in this research that there were big gaps in understanding and engagement, and partly this is to do with the problem that Mohammed has just emphasized, that there hasn't been a major education program for the last 3 years or so. Yeah, I mean, when we looked at basic questions about how much money goes to primary education versus secondary or tertiary, very hard to get data. Where the funding flows go through from the federal level through the state to local government, which has a key role in funding and delivering education. Big gaps in our understanding and engagement. So I think there's And I'd hope with the new program Plane, which is just starting, that we can really get to engage in a more informed way, because I think, as we've been really stressing throughout this session, understanding the governance dimensions of education is absolutely critical. And if we can't engage at that level, all of the important things we do in schools, like school-based management committees or work on inclusive education, won't be as fruitful as they could be. So yeah, my main plea would be really go to the governance end of the chain there. If I'm allowed one more, I think it's on the human resources, that we really found that it's not just a question of money. In the education sector, the quality of teachers has been absolutely critical. There's been a big issue in Nigeria over the last decade. Big steps in Kaduna to actually improve the quality of teachers and make sure that they're properly qualified. So yeah, there was a question from Kathy pointing out that we knew less on public service management. I completely agree. The governance focus has been too much on public financial management. We need to focus more on the human resources, because that's absolutely critical to the quality of the service. It's not just money.
Thank you very much, Gareth. Miani, one thought on one thing to ask FCDO. Thank you.
Well, I probably was thinking to say what Mohammed said, which is 20 years has been a lot of investment, and you're the cost of a lot of consolidation. So whatever FCDO needs to do, don't pull back on support. And then maybe an additional thought is, whatever comes out of the 2023 elections, there will be a new government. And if it's the ruling party or another party, at least at the federal level, and most of the states, there will be new governments. There is a 20-year study that has just been carried out now, which consolidates all of the support. That is a fantastic place to launch engagement with new governments at the federal as well as the location, so that even if there is a change in ideology and the persons running things, FCDO would position itself pretty much as a partner on institutional memory and enable the new governments to build on the 20 years of work of the governments in the country, as well as FCDO's work as well. So be very deliberate and mindful on building on that after the elections.
Thank you very much, Miani. And I want to thank all of you who joined the panel today as speakers for all of your very insightful comments and reflections and all the insights that you shared with us. I also want to thank our audience for being very engaged and asking a lot of questions that I'm afraid we were not able to answer or address in full, but it's always good to have that set of questions out there in case we can delve more deeply into them with more time another time. And I also want to say this is the close of the three-part webinar series that LEAP has launched to be able to share the findings and insights emerging from the research that we carried out with our Pearl colleagues. And so it's a moment for me really to thank all of our colleagues and collaborators within Pearl itself, including in ARC and ECP, within FCDO, of course, and especially within LEAP, where we had a really great team, lots of engagement and commitment from a lot of different people, including from ODI, from the policy practice, and researchers and experts and practitioners who came and went as the hour of need came. And we hopefully leave you with a very rich set of studies and reports that are all now, those that are publicly available should now be captured in the Pearl website, as well as linked to the ODI website as relevant. And it has been quite the journey. We are hoping that we will do a few blogs reflecting on these webinar series and the different events that we have had. So look out for those as well. But for now, we will leave you and hopefully the Pearl journey will continue and the learning will not stop, as our colleague Miani and also Mohammed, Gareth, and Joe have expressed. So thank you so much for all of you for joining, and yeah, the fun stops here, I suppose, for this for now. Take care. Thank you.